Welcome back to SIROWORLD 2016. I'm David Temple. Look at all these bright, smiling faces here today. Good morning. Hello.
Good morning.
You having fun?
Absolutely. Yes.
I'll tell you, you're the sparkiest bunch yet. We've got Patti DiGangi. We've got Deb Nemes, Dr. Scott Benjamin, and Kim Miller.
Good morning.
Good morning. I've got a real official title up here, Technology Integration to Improve Workflow and Enhance Patient Care. Wow. I know. See,
it's a big mouthful.
It is. But it's really just about workflow, patient care. Why don't we start with, well, you know what? We were talking about lasers and such. What's the value of technology in periodontal care, Dr. Scott Benjamin?
All technology that we use in dentistry really only serves two functions. Number one, most important, will enhance the quality of care. And that's the number one thing with any technology, whether it's lasers, whether it's ultrasonics, whether it's digital imaging. We want to enhance the quality of care we deliver to the patients. And the second thing technology does is it improves our efficiency. It enables us to literally do quality work in a much more efficient manner. And those are the two basic principles of every piece of equipment, materials, whatever we use in dentistry. Those are by far the most important things.
Deb, you were nodding on part of that. Let's talk about digital imaging and the importance.
Absolutely. It's increased the efficiency for office staff over the last few years drastically. Helps patient, it benefits the patient as much as reducing the radiation. We're absolutely, much more confident in being able to diagnose, also being able to bill their insurance and get reimbursement for the treatment that's needed.
And Patti, let's talk about the world of coding and metrics. We were talking before we came on, and that's so exciting. That's an exciting. You make it sound exciting. Let's talk about that.
And as a clinician, I'm surprised. But I am. I'm very excited. I'm very excited about the changes that are happening in the coding world because of the changes that are happening in our society as a whole about moving toward health. And having the ability to find things earlier by using radiology excellence and being able to retake them very easily if they're not good enough the first time. All of those things help enhance the coding world, but also help our measurability, because we're moving into an arena where we just have done a bunch of stuff and hope it worked, to having ways of measuring, did it work? And so the metrics are not just about before, but it's also measuring after.
And Kim, you write for RDH Magazine.
I do.
And you love technology. What excites you about it most?
Well, my column is called The Hot Hygienist, by the way.
Whoa.
So, a hot hygienist is using technology, right?
Sure.
And as Dr. Benjamin pointed out, technology should always be used in the best interest of the patient. It's for efficiency. And I'll tell you, one of the things I'm really passionate about is hygienists collecting periodontal data. I can't tell you as a coach, I'm also a coach, and I go into offices all over the country, and patients have no perio charts and haven't had perio charts for years.
Wow.
I have a hard time connecting with that.
Right.
So there's a piece of technology that's available through Florida Probe called VoiceWorks. You wear a little headset kind of like this, and you speak into it, and it talks back to you, and the patient gets to hear it. So when you call out a 4-millimeter pocket, the system goes, "Whoa, warning." It's so cool. That's one of my favorite pieces of technology. Can you tell?
Yeah, I can. Scott, you're about as excited about it as too. I mean, you've been in lasers, what did you say, 20 plus years?
20 plus years, yes.
What are you seeing happening today? What do you see happening today that you didn't see happening 20 years ago? And I know that's a broad question, but more specifically, how amazed are you at the amount of improvement in that short amount of time?
The real value of lasers and technology as a whole is being proactive. Instead of waiting until a disease requires extreme intervention, being able to do minimally invasive procedures, putting a laser in the hands of a hygienist to be used in conjunction with the ultrasonics to really get the tissue to reattach back to the tooth structure, to stop the progression of the disease, and actually use a word that's a little foreign to our dental colleagues called heal.
How about that?
Of actually getting our patients to heal. Because we were taught as dentists and hygienists, we were taught basically to do surgery. And the concept of now getting our patients into a healthier stage with minimally invasive treatments doing it with the hands of our hygienists, and our hygienists are doing wonderful, wonderful things today. Being able to go in and to literally make problems disappear.
I'd like to play off of that because I actually used in the course I just gave the term that we can cure periodontal disease. Now, that's not the way we have thought at all, but it's a different way of approaching it, because if we approach it from that disease-based model that we're just going to manage, we never really get to health. And I really want to get to the highest level of health. Now, people can have health with reduced periodontium, but they can be healthy. But the goal becomes health, and we can do that with the lasers. After we've used the Florida code to gather the data, the digital radiography to get the best images. But the most important part is just our images. I believe that we should be doing full mouth pictures before we do anything.
Yes.
Because that's the best documentation we could ever have for our patients, and for the insurance carriers, but for ourselves. For ourselves. So much about diagnosis is about subtle changes that we can see, measure, and need to use the technologies that are there to see it, to measure it, both before and after.
Yeah.
Deb, I'm watching you shake your head. What were you thinking right there?
Well, there's so many technologies available today in these offices, and so they can pick and choose where they want to start. You know, and one of the biggest ones to start with is digital radiography. So if offices are in there still using film today, I suggest that they, come and look at the booth and implement that immediately. I think that's a great step to start with, and then go ahead and start advancing with other things.
Yeah. And when we're talking about technology too, I want to make a comment about the Cavitron Touch, the new ultrasonic magnetostrictive unit. It's an amazing piece of equipment. I was over there playing with it yesterday, and I just can't imagine. In fact, I have to share a quick story. I was talking to a dentist here on the floor, and she was telling me that her hygienists are using a Titan scaler. I was like, oh, you need to go look at the Cavitron Touch. So I actually saw her at the booth, which was great. But we do have to use this technology. It needs to be in our hands.
Absolutely.
Well, yes.
So I have to say, too, there's something else at the end that I just talked about it, is when we're talking about this whole perio world, something happened and is happening in January that's going to rock the whole world, and that's that we're going to have a code for gingivitis care. Before, everything was we waited till bone loss, and then we have all these perio codes, and everything else was a prophy. But now we're going to have a gingivitis code. It's going to shift things in ways that we can't even get our heads around. And what's great about it is it's not age-based.
Yes.
Because when we talk about biofilm pathogenicity, that's not age-based. And all these technologies, we don't usually chart children, or none of that washes with where we are with science. So these technologies that we have are going to be, I actually look at that code as a game changer. It's going to help push more and more practices to really recognizing a prophylaxis is one of the most submitted code there's been. Well, we're going to have way, way fewer of those, because I've asked hygienists across the country, and I asked them, how many healthy patients have you ever worked on? And I've gotten numbers like 8, 10. I go, percent? They go, no, 8, 10 in my whole career. Oh. Because we are really dealing with gingival disease or periodontal disease all the time.
Yes.
Well, statistics actually showing that people over the age of 35, that over 75% of Americans today have some form of periodontal disease, which is a devastating number. And the idea, the ability to go in and intervene in the process, try to reverse it, try to get it back to a stable, cleansable condition that the patient can maintain with routine care is extremely important. And being able to use digital radiography, so we're decreasing the dosage of radiation that the patient is exposed to, is extremely critical. Being able to go in and to get the patient to a stage that they can maintain it themselves.
Before bone loss.
And that's exactly it.
Right, and that's the code you're talking about, Patty. In fact, the code reads supra bony pockets. Do you know, I've had hygienists ask me, what's a supra bony pocket? It's not in our purview. It's not something that we think about, because we're always about the bone loss and the pocketing.
Disease-based.
Exactly.
Disease-based.
Well, you guys bring a whole lot of a whole new level of enthusiasm to this topic, and I appreciate you taking the time to chat with us this morning.
My pleasure.
Enjoy the rest of the show.
Glad to be here.
Thanks for having us.
Absolutely. Let's take a short break and come back with more Zero World 2016 after this.